Assalamu alaikum. It's Zubar Sahar and today I'm here to talk to you about the reasons why most of us are afraid to leave our homes today. The coronavirus, but first we shall talk about what pandemic means. Come on, slide number 1. An epidemic can be defined as a widespread occurrence of infectious disease in a community at a particular time. When an epidemic becomes so widespread that it begins to cover an entire country, continent, or even the whole world is called as a pandemic. From the bubonic plague in the early 14th century to the Ebola virus in the 21st century, our world is no stranger to pandemics. One such pandemic that has a strong grip on the world today is the coronavirus disease 2019, or commonly referred to as COVID-19. Now come on, slide number 2. COVID-19. The COVID-19 pandemic was caused by severe acute respiratory syndrome's coronavirus 2. It means SARS-CoV-2. On 12 January 2020, the World Health Organization, means WHO, confirmed that the novel coronavirus was the cause of this respiratory illness that was first reported in the city of Wuhan, China, where this virus was spread through bats or pangolins still remains a mystery of date, but there is no doubt that it is the defining global health crisis of our time. As of 17 October 2020, 39.2 million cases have been reported across 189 countries and territories. But the WHO, means World Health Organization, estimates that around 800 million people in total may have been infected. The disease has killed 1.1 million people, more than 27 million have recorded. The coronavirus as COVID-19 is inciting panic of a number of reasons. It's a new virus, meaning no one has immunity and there is no vaccine. Its novelty means that scientists are not sure yet how it behaves. They have little history to go on. Now we can come on slide number 3. Symptoms of and transmission. Symptoms of the virus including fever, cough, and fatigue, making it almost impossible to define it. With the common cold in more severe cases, there is shortness of breath and other respiratory problems. COVID-19 spread easily and substantially through the air when an infected person breathes, sneezes, cough, talk, or sing. It may also be transmitted via contaminated surfaces. Although this has not been proven, in certain cases, infected individual does not even show the symptoms, making detection of the virus almost impossible. The problems of such a virus is that one infected person can infect 10 more without him even realizing it, and the cycle continues, which results in the entire population of a certain areas becoming affected. The less commonly symptoms of the virus are body pains, sore throat, diarrhea, headache, loss and taste of smell, a rash on skin, or discoloration of fingers or toes. Now we will come on slide number 4. How it spreads. The spread of COVID-19 can be shown with the help of this picture. One infected person infected two individuals who infected 4 more who will infect 8 other individuals. Hence, the numbers of infected individuals increases exponentially. If even one person follows the proper precaution, they can reduce the number of cases almost half. Slide number 5. Reduction in transmission. Recommended measures to reduce or eliminate the transmission of the virus include frequent hands washing, social distancing, and quarantining oneself in case one becomes infected. Furthermore, one should cough and sneeze and keeping unwashed hands away from the face and eye. The use of face masks to cover faces is also recommended by health officials, whether it be children or adults, as well as the avoidance of handshaking. Fabric masks are recommended to prevent onward transmission in the general population public areas, particularly where distance is not possible and in areas of community transmission. This could include at a school's ground. In some institution, masks may help to protect others because the areas may be infected before symptoms of illness appear. The policy on wearing a mask or face covering should be in line with national or local guidelines. The mask should be worn, cared for, and disposed of properly. Right? We will come on slide number 6. What to use to wash your hands? Next up is what should we use to protect ourselves from the virus, soap or sanitizer? The answer recommended by doctors worldwide is both. Soap and sanitizer both help to kill off the virus in their respective ways. We need to make sure to cover every inch of our hands in order to destroy the virus completely. Sanitizer have one benefit over soap and water, and that is the lack of needed for water, which makes it extremely beneficial of people in places where water is scarce or not readily available. Now we will come on slide number 7. Face mask. It's not just the use of sanitizer or hand soaps, but also the use of face masks and social distancing to better fight of the virus. There are many different face masks available in the market, including surgical mask, the N95 respirator, the P100 respirator, the full face respirator, and even homemade masks. Furthermore, individuals who are using the surgical mask should make sure they are covering their nose and mouth as shown on the picture on the right. Now, come on slide number 8. The do's and do's not of face mask. There are some do's and does not wearing a face mask, which are shown on this slide here. I will start with those. Before wearing a mask, we should wash our hands and check for any tear on the mask. Find the top side of the mask, which is unusually where a small metal rod is located. Ensure that the colored side in is facing outwards. The metal rod should be placed over your nose and the mask should cover your nose, mouth, and chin without leaving any gaps on the side. We should avoid touching face and while removing the we should do so without touching the mask itself and dispose it off in the proper way, and we should wash our hands after distancing the mask. Some don'ts related to wearing face masks include not using a damp or thrown mask and not covering the whole nose and mouth. We should make sure the mask is tight and not loose. We should not touch the front on the mask, and we should not remove the mask in order to talk to people, and we should avoid are using the same mask, right? Come on, slide number 9. Vaccine. As far as transmitted are concerned, it is unfortunate that no vaccines or most infection treatments for COVID 19 yet. All through several are in developments, with China and Russia in the lead. Management of COVID 19 includes involves the treatment of symptoms, supportive care, isolation, and experimental measures. While some Western traditional or home remedies may provide comfort and alleviate symptoms of mild COVID 19, there are no medicines and that have been shown to prevent or cure the disease. WHO means World Health Organization does not recommend self medicines with any medicines, including antibiotics, as a prevention or cure of COVID 19. However, there are several ongoing clinical trials of both Western and traditional vaccines. WHO means World Health Organization is coordinating efforts to develop vaccines and medicines to prevent the treat COVID-19 means the coronavirus, and will continue to provide updates information as soon as research results become available. Now we will come on slide number 9. Dealing with COVID 19 means coronavirus. As far as life during COVID 19 is concerned, most people have ended up working from home, and the power of technology has really come to life. People were confined to their homes, and that made the way of life extremely difficult for almost everyone. But slowly and surely, people learn to adapt to the circumstance of dealing with this pandemic and how technology can really bring peoples together and help in terms of meeting and education purposes. It is definitely worth saving that adjustment and adaptation are not always easy. This time we are going through is certainly rough. Since the start of the pandemic in Pakistan, there has been increases in the numbers of people reporting sleep disturbance, and the numbers of people utilizing mental health hotlines has greatly increased. While humans are resilient, we are also human, right? It is important to recognize that this time is super stressful and to understand the efforts of such stress on the human body and help yourself adapt in a positive way. Please stay home, stay safe. Thank you so much for watching this video.